One of the things that families and patients are so terrified about is what happens at the end. What happens when I'm actively dying? Or for families, what do I do when my loved one is actively dying? People are terrified that at the end of life, they're going to be in tremendous pain. That their organs are going to fail and they're going to fall apart. And the reality is that for most people, it's a very peaceful process. As the body starts to shut down, people who are dying typically spend less and less time awake, more and more time unconscious, and most gradually drift into a coma in the hours to days before death. And there are a number of things that are very normal that happen that families need to be aware of. It's very normal for people to produce less urine, that the body again stops making fluids and urinating stops. The hands sometimes turn a little bluish color as blood flow gets reduced. And again, if you know that's happening, it's nothing to worry about. You just rub the hands, keep them warm, put them under covers, or hold them. People often ask me, are they aware of what's going on? And the answer is, I don't know. I suspect they are, based upon what I've seen. I always advise my families that I think people can hear you, that hearing is probably the last sense that fades, and that never have a conversation in front of your relative who's dying that you would not have in front of them normally, and always talk to them. Don't be afraid to hold them. Touch is incredibly comforting, and it's something we don't do enough of in medicine. Breathing patterns change. That slow, regular breathing becomes what looks to be labored, but I would describe as just irregular as people near death. And that people will often take a deep breath in, there'll be a long pause, and a couple of shallow breaths and another deep breath. And that change in breathing pattern is often a sign that death is imminent. And when things get right at the end, they may just take a deep breath, there'll be a pause, and then breathing will stop. Occasionally, very occasionally, it's not that peaceful. And as the body starts to slow down, some toxins can build up in the blood, and that can cause some agitation or what we call delirium or confusion. And that can be very frightening because people often think that if somebody's moaning or moving around, that they're in pain. Usually it's not pain. Usually it's toxins irritating parts of the brain, and we have very good medications that treat that make people comfortable and eliminate that symptom, just the way that opioids eliminate pain. And so it's really important for families to know about that so that we have the medications, so they know how to administer the medications, or can call the nurse when that starts to happen. People ask, is there a discomfort associated with dying? Particularly when people stop eating and drinking because they're too weak. People who are dying don't experience hunger pangs. If you or I, for example, got hungry, went on a diet, it feels pretty miserable. People who are dying don't experience that. And in fact, force feeding them or forcing them to eat actually can cause more distress. People do experience thirst, but the treatment of that is very simple. It's moist washcloths along the lips, Vaseline, lip balm, and frequent moisturizing washcloths, swabs around the mouth. And that's it. And then when somebody dies and it's an expected death, there's a couple of things that again are very important for families to know. There's no reason to call 911. There's no reason to call for the police or an ambulance. It's an expected death, and we know this is going to happen. Stay with them, and when you're ready, pick up the phone, call the palliative care team, call the hospice, call your doctor and just let them know that mom, dad, whomever has quietly died.